Right, so this is part 3 of the blood, which is chapter 19, and we are talking about the different types of cells. We already talked about the red blood cells, we talked about the white blood cells, and we will be talking about the platelets. But let me ask you this. Each one of those 5, what do you know about the monocytes? Just bullet points, just 1 point. Large, macrophages. Okay, how about eosinophils, microphages, and 2 more things, 2 words. Parasite, and the third, allergies. Yes, parasite and allergy. Basophils, inflammation. And what are the 2 H's? Histamine and heparin. And each one of those have a function. Heparin is vasodilator, and heparin is anti-blood clot. Neutrophils, largest number of white blood cells, this is 1. Macrophages, that's 2. Last one, bacteria. Excellent, yes, bacteria. Lymphocytes, specific defense, specific immunity or defense. Which one is cell mediated, T or B? T. And which one is antibody or humoral? B, yes. All right. You have the time to study until the exam come, but at least if you find yourself not remembering the basics that I talked about, put some more time and get ready. Okay, so the last blood cells are the platelets, and the other name is thrombocytes. Thrombo means platelets, or like pieces, fragments. Cytes means cells, right? So we say erythrocytes, leukocytes, thrombocytes. All of them end with cytes, which means cell. So erythrocytes, the red cells, leukocytes, the white cells, thrombocytes, the fragment or platelet cells. These circulate for 9 to 12 days only, and then it will be removed by the spleen. This is a normal number, 50,000 to 500,000, which is still way less than the 5 millions of the red blood cells. The function simply of the platelets is blood clots. Blood clot. What's going to happen here? They are going to release chemicals that we'll talk about. They will make a patch, and this will end up making the break in the blood vessels smaller. Here is a blood vessel. There is an injury of the blood vessel, cut. It's bleeding. The platelets are going to do the following. Chemicals are going to be released. Platelets will make a temporary patch. It's not the final fix. It's just a temporary patch. And then when everything shrink, it's going to decrease the break. And there are different steps that I will be talking about. But the same thing as we talked about before, if you see thrombocytopoiesis, can you cut it into different pieces and tell me what does it mean? What's thrombocytes? Platelet cells. And what's poiesis? Formation generation, right? Aren't we repeating the same words over and over again? So this is a process of the platelet production. Just like everything else, we make it in red bone marrow. What's the one thing that's unique where it come from. Lymphocytes. Lymphocytes will make good part of it in the lymphoid tissues. Megakaryocytes. What was the grandmother cell or the mother cell of all the cells, all the blood cells? Hemocytoblast, and then myeloid and lymphoid. Everything is myeloid except lymphocytes, lymphoid. Here we start with megakaryocytes. Megakaryocytes. Karyocytes is the same as thrombocytes. It just, instead of pieces, it's a big cell. Mega means large, huge. Megakaryocytes. So this is the one that's going to be broken down into smaller pieces, and these smaller pieces are called the platelets. Okay, so this is the origin of the platelets. This is in the bone marrow. And then you cut it into smaller pieces, which are the platelets. So megakaryocytes. Remember, if every one of the cells, we mentioned a hormone that stimulates its production. For the red blood cells, what was the hormone? Erythropoietin, yes. And for the white blood cells, generally speaking, start with C, colony stimulating factor. Colony stimulating factor. Stimulate white blood cells colonies. That's it. For platelets, there is thrombopoietin. What does it sound like? Huh? Yes, erythropoietin. It doesn't sound like it? Erythropoietin. Thrombopoietin. Erythro is red. Thromboplatelets. Very clear. Erythropoietin is the hormone that stimulates red blood cells. Thrombopoietin is a hormone that stimulates the production of the platelets. Is that clear? If you know what's thrombo and if you know what's poietin, you get it. If you know what's erythro and what's poietin, again, you get it. If you know what's poiesis, this is coming from poiesis. It's the same word. We're repeating. Okay, so thrombopoietin is that hormone that stimulates the production of the platelets. Plus, there are other things like interleukin 6 and multi-CSF. Remember the multi-CSF? One of the CSF for the white blood cells. It also stimulates the platelets. It's for the white blood cells, but the multi one only stimulate the platelets as well. Now the process itself. Hemostasis, translation. Hemo means blood. Stasis, stop, static, stop. Hemopoiesis, stop bleeding. I'm sorry. Hemostasis is to stop bleeding. So let's say you have an injury and your blood vessel is cut open, a tiny opening, but it's bleeding. What are the different steps that we're going to do in order to stop that bleeding? This goes exactly, to me, it goes exactly like what would you do if you have a broken water pipe in your house? Do you call the plumber and wait until he come, and by that time your house is gone, ruined? Of course not. There is something emergency, right? It's common sense. Personally, I wouldn't wait. I wouldn't call the plumber first. I would get something and stop it temporarily so that my furniture is not ruined. I will call somebody in my house to shut down the water so it doesn't ruin the house. And then I'm going to call the plumber to come over and fix it, the permanent fix. Isn't that common sense? This is what we do, exactly what we do here. That's exactly the same. So the vascular phase is you're calling somebody to shut down the water, the main water valve, shut it down. So vascular phase means blood vessels constrict. So the blood stop coming to that area, right? Vascular, I'll go to the details, but let's just understand the basics. So vascular phase, blood vessels constrict, so you don't lose much blood. Number two, You get anything and patch it temporarily, right? Can you stay like that? Can you get like a bag or something and put it and just wait and that's it? Or this is a temporary fix? This is just temporary, right? Same thing here. Platelet phase, the platelets will come in that spot and just seal it temporarily. That's not a fix. Simply, if you touch it, the platelets will go away and you start bleeding again. It's just a temporary fix, just like you're putting a bag or something temporarily until you fix it. Coagulation phase, this is the plumber coming to fix it for you. So it will take multiple steps to fix it, but at least first you constrict, less blood come, seal it, temporary seal, unless this coagulation phase that takes time to fix it. The plumber is coming and taking this part and changing and all that stuff. Same thing here. So these are, what do we mean by each one of those? The vascular phase, I just mentioned it, which is vasoconstriction. You constrict the blood vessels so that you don't lose much blood. Less blood is coming, that's good. That's going to help you shut down the main water valve. Okay, so the smooth muscles are going to contract, constricting the blood flow, and this is going to stay about half an hour, giving you some time to take care of it. Yes. Uh, the scalp is something that's more advanced. It's exactly like this. You know, you're bleeding, 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 and after some time, it just stop. Nothing happened yet, nothing formed yet. But if you touch it, it will open again. This is a platelet phase. The one that you're talking about, when there is like a little bit of a cover, I understand it's not dry yet. But when there is a cover, this is the last one. Okay. Yes, this is what's happening. But the one that we think about is the third one. The second one is just once the blood stop, right? Just it bleed for few seconds, for a minute, whatever, less than a minute, and then you see it stopping, isn't it? It stopped temporarily. What's stopping it? Temporary seal, which is the platelets. What if I touch? It will open. There is nothing. It's just a temporary seal. Later on, you will see something on it, which is the actual blood clot, something that it's in the beginning it's wet and then it will be dry and then it will fall off, right? All of these is the third stage. So vascular phase, just smooth muscles contract and blood vessels constrict. So what are the chemicals that are going to lead to the other steps? Like platelets are going to come this in this area, accumulate there, and make a temporary seal. Who is going to make the platelets? Like why the platelets doesn't clump or doesn't stop in this area by itself? It isn't our platelets right now is floating in the blood and moving all the time 24/7, right? Why it doesn't stop? There should be something, there should be a change that happen that leads to the platelets coming in this specific area to seal it. What is it? Simply when you injure your cells, they are going to release some chemicals. And these chemicals include ADP, tissue factor, and prostacyclin and endothelin. These are going to make vasoconstriction, these factors, and also the endothelial cells. Do you remember endothelial, epithelial, endothelial? That was, I think it was chapter 4 or something, 233, the different types of cells, connective tissue, and endothelium is the innermost lining of the blood vessels. This will become sticky because of these factors. They will become sticky. When they become sticky, any platelets coming will stick itself. So that will lead to the next one. So here is a vascular phase first. You make a cut, vasospasm or vasoconstriction, so you don't lose much. You don't lose much blood. And then the factors are going to be released that I talked about, including ADP and endothelin. And this will lead to vasoconstriction and it will make the endothelium sticky. Now the endothelium is sticky. Platelets traveling in this area They will be stuck in that sticky space, and they're going to aggregate, meaning it just goes like the dominoes effect. You know the dominoes effect? Push one, next, 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 next. The first group of platelets stick themselves, other platelets coming. When they find some platelets, they will add to it, stick to it, stick to it. This is something that's unique for the platelets, that if they see platelets stuck, they stop in that area and stick itself as well. You end up making something called platelet plug. Platelet plug. The platelet plug is a temporary seal. Is it fixed yet? No, it's not fixed yet. Temporary seal. It's called platelet plug. The platelet, it's making a temporary plug. Okay? So that at this point, you stop bleeding. So when the platelets stick itself in that sticky endothelium, they become activated and they are going to release factors. These factors will add up more platelets and it will lead to the next step as well. ADP, thromboxane A2, serotonin, clotting factor, and calcium. All of these are needed in order to help you make the final step that's coming. So what's activating other platelets and preparing for the next step? It's ADP, thromboxane A2, serotonin, clotting factors, and calcium. So what's happening here? This is the step number 2, blood vessels already constricted. This was number 1, vasoconstriction, spasm. This was 1. And then the surface, here is the endothelium surface. It will become sticky because of these chemicals, because of the damage and the chemicals coming. So the platelets start to come to this area, stick itself, and other platelets passing by, when they find some platelets here aggregating, they will add themselves and stick themselves, ending up making this purple that you see here, and this is called a platelet plug. This is, if you just touch, it will open again. It's just a temporary seal. And the chemicals are going to be released, and it will go to the next final stage, which is coagulation phase. Coagulation phase is the actual blood clots. And this is what you were saying. This is the platelet, the blood clots. Okay, so did we get the difference between platelet plug and blood clotting? Blood clotting is the final one. Platelet block, temporary seal, just a group of platelets. That's it. It's not asphyxia. But coagulation is the last one. And there are coagulation factors, 11 different factors plus calcium. Should we remember 11 different factors in calcium? Yes. You have to remember that calcium is also needed here. Calcium is not only for bone. We have a lot of uses for calcium. This is a very important one. So guess what? If you don't have enough calcium, you will have more bleeding. Okay? If you have hypocalcemia and you have bleeding, instead of stopping in few seconds, it will stay, continue, because you don't have enough calcium. Calcium is needed. Plus the other different 11 different proteins that are also needed in order to do this coagulation phase. There are some enzymes that are going to be activated. These are inactive enzymes called proenzymes. They will be activated to help the process of coagulation. So, how the coagulation occur? There are steps, but I'm not going to go through like every single steps. I will just give you the general idea, but the last one is what you have to know, the common pathway. So what's intrinsic and what's extrinsic pathway? And then the common pathway from both of them. So somehow, either external, extrinsic, like a cut, or intrinsic, and I will talk about it. In both cases, the final step will happen anyway. You end up having blood clots. So both intrinsic and extrinsic will lead to the last one. Extrinsic. There are different factors, and we're not going into the details, that will be too much. But factor after factor, like 3 and 7, whatever the numbers, you don't have to know. But at the end, you activate something called factor 10. This is the one that we need to know. Extrinsic pathway. And what extrinsic means? Extrinsic mean external, right? So something happened from outside. And this is the normal one. If you have a cut, don't you want this wound to be fixed? Don't you want the bleeding to stop? So this is normal. The extrinsic pathway is normal. You have a cut, and because of that cut, some of the factors that are going to be released will end up activating factor called factor 10. Intrinsic pathway is another thing. It's called what? Intrinsic. What's intrinsic? Nothing happening from outside. There is no cut, there is no injury, nothing happened. It's just something wrong in the blood from inside. And that's why we call it intrinsic. Enzymes, somehow, the proenzymes will become activated and become enzymes. Extrinsic pathway does the same thing. Yes, we have proenzymes in our blood, inactive. Are we following? In your blood, you have inactive enzymes all the time, okay? If you activate it, you go through the process and go to activate factor 10. Are we following? Now, who activated these inactive enzymes? Either something happened from outside, like a cut or injury, which is normal. We need that to happen. Or it just activated by itself. And this is bad. Because the first one, you needed to stop the bleeding. Why do you want to stimulate these enzymes and end up having blood clots and your blood vessel is intact? There is nothing wrong. Why do you need it? Right? This is called the intrinsic pathway, and this is a bad one. Because I understand that if I have an injury, I want to activate my proenzymes and I want the process to go to factor 10, and I will tell you the rest. At the end, blood clot, healing. That's good. But what if you don't have anything? Your blood vessels are completely intact. Of course, I don't want the enzymes to be activated, but it happened by itself. Do you hear about people getting stroke or heart attack or something? Did they get any injury or anything? Nothing. It just all of a sudden it happened. Yes. The intrinsic pathway. The intrinsic pathway that happened without injury. We hear about that all the time, right? He's completely normal, no injury, nothing happened. All of a sudden, heart attack. All of a sudden, stroke. We hear about this, right? This is the intrinsic pathway. Who activated the proenzymes, the inactive enzymes? We don't know exactly. It's just something happened, unknown, that there are different reasons, but whatever the reason is, there is no injury. The blood vessels are completely intact. Why do you need the blood clot? You don't need it, right? But it just happened that the proenzymes, the inactive, become activated, and it will lead to factor 10 being activated as well. In both cases, whether you did the extrinsic, which is good to stop the bleeding and heal, or it happened by itself, in both cases, you end up activating factor 10. Factor 10 is going to activate something called prothrombin activator. So from the name, what's pro means? Just like gen. If you put pro in the front of any word, a prefix, is exactly the same as you put gen at the end. What's gen at the end? Inactive form of or generator of, right? It's the same here. Pro, say exactly the same. Inactive form of something. So this is prothrombin activator. Prothrombin activator. What's the prothrombin activator? I think the name gave it away. Prothrombin activator. Activate prothrombin. Clear? Activate prothrombin. What do you think will happen if you activate prothrombin? This is your first time to hear it, but tell me, what do you think? Prothrombin, when you activate it, what you get? Huh? Thrombin. Yes, just remove the pro or remove the gen. Isn't it the same thing? Do you remember this? Gen or pro, same thing. Remove the gen, remove the pro, you get the active form. Is that clear? So what happened when with this prothrombin activator? It's the name gave it away. Activate the prothrombin. What's the active prothrombin? Just remove the pro. Thrombin. What's a thrombin? What's the importance of thrombin? Thrombin will activate fibrinogen to what? What do you think? Fibrin, just remove the gen. Pro-gen, remove one of those, and you get the active form. So what I get at the end? Fibrin. And this is our final product. And this is the blood clot. Fibrin is fibers. Remember what you have already from the previous step? You have platelets, right? If you touch these platelets, it will spread, right? But if you put like a net around it, net of fibers around it, now you make an actual clot. So this is the final product that we are looking for. This is going to entangle and surround the platelets and some red blood cells around it, and you get the blood clot. If it was extrinsic pathway and you get blood clot, this is going to fix this injury, and the endothelial cells that was cut will regenerate. So that's good, right? That's good. Isn't that what we need? Right? You constrict it first, less blood, temporary seal, good. I stop the bleeding. Now I need the actual fix. Blood clot. And the blood clot will fix it until the skin or whatever was cut regenerate and heal. That's it. That's all what we need, right? What if it is intrinsic? I didn't have injury in the first place, right? So when you have this blood clot inside your intact blood vessel, it's not only useless, it's harmful. Why? Simply, you have a blood clot inside your blood vessels. It's going to travel with the blood. In this area, the blood vessels are big, so it will just run, right? We know that the blood vessel is just like a tree, branching, 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 branching. This is the blood vessels. Do you remember the lab models? Start with the aorta and get the smaller, smaller. Do you remember all these vessels here? So it will travel, 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 smaller, 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 until it get into a vessel that the diameter is smaller, stuck, blocking the blood supply. And it's all about your luck. It can block something in the eye. It can block something in the brain, stroke. It can block one of the arteries that we talked about. Do you remember these arteries, marginal artery and all these? It might stick there. We don't know. This is completely random. We have no idea. It travel, 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 travel randomly until it stick or stuck itself, closing one of the small blood vessels, and this will die. This part will die. Because if you deprive it from oxygen, and this is, it's, I don't want to go more than that. It's not really permanent. I mean, if something like that to happen, there is a treatment in the emergency room. There are injections that can actually break it down. But if you just leave it alone, no blood supply, this area will die. Is that clear? So extrinsic pathway, injury, all these factors, activating factor 10. Or intrinsic, we have no idea what's happened. Something happened that activated the proenzymes, and you end up activating factor 10 as well. So here is what you have to know, the common pathway. Whatever the reason that you activated factor 10, this is your issue. You activated factor 10, or you activated the proenzymes that activated factor 10. Factor 10 will activate prothrombin activator, that will activate prothrombin to thrombin, that will activate fibrinogen to fibrin. Look at the fibers. See those blue? Making like a network or a net around the platelets. And this is the blood clot. Here's how it looks like. Look. Platelets and some red blood cells trapped, like if you're throwing the net like this, and platelets are there. Some red blood cells are there as well. So it will make it all together in the form of blood clots. This is an example of the positive feedback. Do you guys remember positive and negative feedback from AP1? This is a positive feedback. In what do you mean by positive feedback? How? Meaning that when the platelets come to that area, it sends chemicals to bring more platelets, that will send chemicals to bring more platelets to more, lead to more. This is positive feedback, isn't it? The opposite is a negative. If your body temperature goes up, you will bring it down, right? This is negative. Here, up, lead to up, positive feedback. Do we have something to stop this process from happening randomly? Do we need it when we have bleeding? Yes, of course. This is good. Leave it alone. But if this is happening without a reason, we do have some uh, factors that will prevent it from happening, like anticoagulants, like antithrombin 3, for example. From the name, anticoagulant. It stops the coagulation, right? Heparin is another thing that's remember the heparin and histamine that we talked about from the basophils? It's anticoagulant. It just activates the antithrombin 3. Here it is. So we have antithrombin 3. Is that something good? It is good if you don't have an injury. It will stop the clots. Why do you need coagulation if you don't have issues, right? Antithrombin 3 is going to help you. Heparin is something that activates antithrombin 3. There is another thing that's called thrombodulin, and this will activate something called protein C, which will inactivate the clotting factors. So basically, if we have, for example, if we have a patient that's like in the hospital, hospitalized, and he's not moving much. When the blood doesn't move much, there is more chance. And this is one of the reasons. Remember when I told you we don't know exactly what happened to activate these proenzymes and start the process? There is no injury. How did it stop? One of the reasons is you're staying and not moving. Stasis, blood stasis, will lead to one of the factors that lead to activation of this process. And that's why if we have somebody, this is something automatically we do it in the hospital. If I know that this patient is not moving much, we give him heparin just to avoid the blood clot. It's expected. You might have blood clot because of the stasis. So heparin is anticoagulant by activating antithrombin 3, which prevents blood clots. The process of blood clot itself needs calcium. Do you remember when I told you calcium and 11 factors? Otherwise, you will not be able to do the coagulation. Are we following? If you don't have calcium, you have bleeding, right? Vitamin K is also involved in this process. We don't have to go into the details. Just remember that those two are needed. That's it. If you don't have enough, you have prolonged bleeding, calcium and vitamin K. You don't have enough calcium, you will have bleeding. If you don't have enough vitamin K, you will have bleeding. Okay, and do you guys know? Did you hear about vitamin K before? Like, where do we make it, or how did we get most of our vitamin K? Did anybody hear about this before? The vitamin K, we eat it. That's okay, but where is the major part come from? Come from the bacteria in your colon, in your large intestine. Your bacteria, the useful bacteria, the good bacteria, they make it. Okay, they make it inside our large intestine, and we actually need it. You have to have it. We hear about the probiotics, right? It's something bacteria. It's good bacteria that makes vitamin K for us. Okay. I think you guys can guess what is this, even if it's the first time to see it. What is this? Thrombocytopenia. What does it mean? What's thrombo and what's cyto? Platelet cells, and what's penia? Huh? Small amount, yes. Low count or small amount, yes. Pinia. Do you guys remember pinia versus cytosis? Uh, I talked about this Tuesday. Pinia cytosis. You guys have to know to remember these prefixes and suffixes. Trust me. This is like you're solving a puzzle. Remember the prefixes and suffixes, and that's it. This is my first time ever to see this. I have no idea what is this. That's okay. Thrombocytes, I know that thrombo means platelet, cytes means cells, right? And I know that pinia, remember leukocytopenia and leukocytosis that we talked about? You're using the same thing over and over. That's not English. This is how it works. So thrombocytopenia is if you have deficiency of the thrombocytes or deficiency of platelets. Hemophilia and thrombophilia. What's hemo? Remember hemostasis? What's hemostasis? Stop bleeding. How about this? Love bleeding. What does it mean? Yes, more bleeding. More bleeding. Make sense? Hemostasis, hemophilia. Stop bleeding, love bleeding. It means more bleeding, basically. Okay? Thrombophilia is more thrombocytes. We have a lot of thrombocytes. DVT, deep venous thrombosis. What does it mean? Deep veins. Do you know that you have superficial veins? If you look, you see veins here, right? The ones that you can see are superficial, just under the skin. But there are deeper ones, deep inside. Okay? These deep veins, if thrombosis happen there, thrombosis is formation of blood clot. Thrombosis, like a lot of thrombocytes. Thrombocytes, which is clots. You got a blood clot. In the deep veins, most of the time it's in the lower limb. Okay? If that happen in the veins, in the deep veins, what do you think it will go? We did the heart in the lab. Can somebody tell me if one of the deep veins of my leg, they got blood clot, where does it go? To the heart. Which side? Right side. Right side, right? And then what? Right what? Right atrium. And then right, what's after the right ventricle? What's a blood flow? Pulmonary trunk, right? And then pulmonary arteries, and then lung. That's it. It cannot bypass the lung. Why? Because pulmonary trunk and pulmonary arteries, and then small arteries, and then arterioles. Impossible to pass all of this. Impossible. It goes smaller, like if you're going like in a big street with your truck, and you know that street is going smaller, 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 smaller until it will be like 1 inch. Can you pass through the 1 inch? Of course not. So it's going to branch, 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 and it will make a clot in the lung. Okay? We call that pulmonary embolism. So if I ask you, DVT, can it go to the brain? Impossible to pass the lung. If you actually understand DVT, it's in the veins. All veins will go to the inferior vena cava to the right atrium, right? Just understanding to the right ventricle, to the pulmonary trunk, to the pulmonary artery, to the lung. That's it. It will stop in the lung. So what's the issue with the DVT? Lung. Nothing after that. Do you think it will pass through the lung and go through the capillaries, the tiny capillaries, and go on the other side and return back to the heart, to the left side, and then go to the body? Impossible. Impossible. 0%. So that's the fate of the DVT. So now, let's say whatever happens, we have the blood clot. This blood clot is going to shrink or retract. It's going to, when it retracts, it's going to pull the edges of the cut to come together. Why? Because if it is like this is the blood vessel, right? You cut it. There is a space, impossible to regrow. But when the blood clot come here and retract, they touch each other, right? Now they can regrow. So this is going to pull the edges together, get closer to each other, and fibrous tissue are going to heal this, repair it temporarily until the endothelium regrow. Once the endothelium regrow, you're done with this process. And we call that clot retraction. The fibers, the blood clot, shrink, retract, bringing the edges. As soon as the edges come together, fibers will hold it together, endothelium regrow, and that's it. Remember, I told you in the hospital, if we know that there is something wrong happening, like usually people don't go to the emergency room because you already have stroke. Most of the time, they go transient ischemic attacks. Did we hear about this before? Or angina. Did we hear about angina or angina? It's not really heart attack. Like I got some pain all of a sudden in this area going here, and then it goes away. Like nothing happened to the heart? No, right? This is an alarm that you might get heart attack. Same thing for the brain. All of a sudden, I was standing and then I feel like dizzy and confused and I can't see, and then it goes away. This is called transient ischemic attack. If that happened, rush to the hospital. The good thing is if you bring this patient or this person to the hospital, the emergency room, within like an hour or two, they give him a shot and this will break down the blood clot. If it is too late, it's there and whatever is blocked is blocked. But they always try to um, break it down. So if somebody's having these uh, transient ischemic attacks or angina or something, they don't say, "Oh, I got it," and then it goes away. I'm fine now. No, what make you get this will make you get the worse, right? If you have this temporary, it can develop all the way to the full scale uh, heart attack or stroke. So what do we do? Fibrins. What do you think this means? Hmm? Break down the fibers. Isn't that what we want? The fibers are there. We have a blood clot. If it is good, it's good. We're not talking about this one. What if you don't have an issue? You don't have bleeding. You don't have anything. Can you give me you something that a shot that break down the fibers? If you break down the fibers, everything will be released and it will be fine. All what you need is just break the fibers. Fibrin lysis. Fibrin lysis. What's lysis? Break down. Again, collect the prefixes and suffixes as we go. Okay, it's not going anywhere. Even after you finish AP2, as long as you are in the healthcare field, you're stuck with this forever. Okay. So fibrinolysis is to break down the fibrins. There is something called tissue plasminogen activator. This activates plasminogen to plasmin, and plasmin break down the fiber. Fibrinolysis. What they give us? They give us thrombin and tissue plasminogen activator. Both activate the plasminogen to plasmin. Is plasmin good? Yes, plasmin digests the fibers. And that's it.